Don Williams and Elizabeth Evans for the Institute of Sports and Spines. Today we're doing a brief interview with Elizabeth Evans, who's the newest addition to our team at Institute of Sports and Spines. She brings a wealth of experience in exercise physiology and physiotherapy. So Elizabeth, welcome to the team and tell us a little bit about yourself.
Thank you, Don. I'm really enjoying my time here at the Institute of Sports and Spine. As Don said, I'm a physiotherapist and accredited exercise physiologist. I have over 15 years of work experience in the fitness, exercise and health industry. I've worked mostly treating private patients, sports people, military and police personnel. Being a physiotherapist and exercise physiologist, I have a very unique skill set which I look forward to offering with my future clients. My philosophy to treating patients is go beyond, and what that means is that treating the cause, not just the symptoms, to build resilience in patients and prevent injury reoccurrence. Diagnosing and treating the cause of symptoms provides the best long-term outcome for patients.
Elizabeth, can you tell us a little bit more about your areas of interest?
Yeah, I'm interested mostly in acute and complex musculoskeletal disorders, running injuries, in particular for recreational runners, injuries in adolescents. I like also neurological disorders, spinal disorders, and helping patients overcome issues in that area. I do pre and post-op and surgical rehabilitation, and I enjoy working with sports people. Most recently I've been working with Touch Football Australia, and 2 weeks ago travelled to Malaysia for the World Cup. But I've also worked with athletes in the Australian karate team, surf life saving, World Cup level athletes from gymnastics and Ironman triathletes, and also enjoyed helping out elite runners in the past.
So Elizabeth, can you tell us a definition of what is physiotherapy?
Sure. Physiotherapists help people recover from injury, reduce pain, stiffness, increase mobility and prevent further injury. We listen to your needs and tailor a treatment specific to your conditions. As first contact practitioners, it means that you don't need to see a GP prior to presenting to a physiotherapist. Physios, doctors and other allied health professionals generally work as a team together so that we can manage as best we can your issues. Physios are highly trained and are required to adhere to high professional standards and are committed to proven evidence-based outcomes. The depth and breadth of conditions that we as physiotherapists can treat is quite extensive. In this setting, we work mostly with musculoskeletal conditions such as sprains, strains, tendon overloads, joint conditions. We can do biomechanical analysis and work on motor control.
As an APA registered physiotherapist, they can also access third-party work cover, DVA, NDIS systems through you as well, can't they?
Yes, that's right. So Veteran Affairs patients using their veterans cards for the DVA can come and access physiotherapy services. Those in CTP insurance or a workplace incident, as well as the NDIS system, especially in Queensland, is becoming more utilised by the community.
So, Elizabeth, can you tell us a little bit more about the treatment techniques that you use?
I use a range of treatment techniques with my patients. These include active release techniques, which I'm a whole body practitioner certified, dry needling, exercise prescription, including Pilates. Many of the practitioners here at the Institute of Sports and Spines are DNS certified, and I also utilise these skills with my patients. I can also offer strength and conditioning and functional screening. I have a focus on stability before mobility and building resilience rather than offering short-term pain relief for my patients.
So Elizabeth, can you give us a definition? What is a physiotherapist?
Yeah, physiotherapists help people recover from injury, reduce pain and stiffness, increase mobility and prevent further injury. We listen to your needs and tailor a treatment specific to your condition. As a first contact practitioner, you don't need a doctor's referral to come and see a physiotherapist. Physiotherapists, doctors and allied health professionals often work as a team to manage and plan your recovery. Physios are highly trained and required to adhere to high professional standards. We are committed to proven and evidence-based outcomes. The depth and breadth of conditions that a physio can treat is quite extensive, and in this type of setting, it is often musculoskeletal based, like sprains and strains, tendons, joint issues, or where biomechanical analysis is important to overcome a muscle imbalance or something else that's going on with biomechanics.
Elizabeth, the age-old question that physiotherapists and chiropractors get asked all the time is, what's the difference between physiotherapy and chiropractic, and who's better?
This is a tough question and a popular one. Physiotherapists and chiropractic treatment share many of the same qualities, but each form of treatment has its own benefits. We may use different terminology and techniques, yet we have more in common than what people actually realise. The main difference between the two disciplines is that a chiropractor traditionally uses manipulations and adjustments, whereas physiotherapists will commonly use soft tissue techniques and mobilisations with exercise prescription. Chiropractor usually focuses mostly on the spinal issues, where physiotherapists are a little bit more broad, encompassing the whole body. But we are all looking to achieve the same thing, which is helping people to improve, which means there's no answer of who is actually better, we just have different approaches.
A point you brought up earlier about evidence-based care in medicine, Elizabeth, I thought was really interesting. One of the questions that I get asked at the med school all the time by students is, what do they think of evidence-based medicine, or what do I think of evidence-based medicine? And what I often say is that it's very good at telling us what we shouldn't do, what's been proven to be dangerous, harmful, or not effective, but it's not really good at showing us what we should do, and what is at the cutting edge of science and medicine is always way ahead of where we are with evidence-based. And the thing with chiropractic as a profession that always concerns me is that we have a two-part profession where you have one group that are not really concerned about outcomes. They want you to come in every week for the rest of your life as a wellness client, and then you have people like we have at Institute of Sports and Spines that have a defined outcome in mind. We have a goal that we're trying to achieve, whether it's returning someone to sport following an ACL tear, reconstruction and rehab, or whether it's they're trying to improve their bike setup to stop their neck pain getting sore. So we have these heretical chiropractors that sort of do us a disservice by really not focusing on outcomes. What has been your experience working here in regards to those different approaches to treatment and approaches to care?
I think it's really important to distinguish between the two different approaches of chiropractic, being the wellness and the outcome. As physiotherapists, we heavily rely on evidence-based practice. It's required from the APA Association, and it means that we provide the best outcomes for our patients because we're relying on the research, which guides our practice, as well as clinical experience. So I think it's really refreshing to know that chiropractors of the outcome focus are also following that same stream. And for the wellness chiropractors, I think that obviously they still have a place in the community serving people, but that you'll get different outcomes and different progressions with those sort of treatment approaches.
Another interesting phenomenon we see in healthcare, if someone goes and sees a GP and they have a bad experience, they'll generally say, that was a useless GP, and they'll go and find another one. With chiropractic and physiotherapy, I find that people tend to tar the entire profession with the bad brush. So we'll often have people come in to see one of our chiros for rehab here, and they'll say, I never bother going to see a physiotherapist because they're all useless, which I disagree with. And at the same time, I'll hear them say the same thing about chiros, where some of the physios that I treat and some of the GPs that I treat may start off very anti-chiro because they just go, oh, chiros do this, because we have this vocal minority that might focus on doing essentially manipulation to cure all ills. And so I always think it's very bad to label a whole profession as a result of that one bad experience. What are your thoughts on that?
Yeah, I also have had this happen with patients in the past who have said, I didn't come to physio because I didn't think you'd be able to help me, or no, I've never been to a chiropractor because I'm scared of them and I've heard what they did to a friend of mine. For me, it's all about finding an allied health professional who you can trust. So if you have a bad experience, you should be able to know that you trust that person enough to say, hey, last time I was here, I didn't have a good experience. And I think sometimes patients lose their voice a little, and there's no reason for that. People should be able to step up with their healthcare, and no different to a GP. I often probably am more vocal than some of the patients, but I'll definitely question my GP, and if I still don't feel that the response is enough, then I'll ask them more. So again, I think that whether it's GP or allied health professional, you need to actually find your own voice and say, look, I didn't think that approach helped for me. Can you refer me on to somebody else or try again somewhere else?
Another thing that many patients aren't aware of when people come into the Institute of Sports and Spines with our chiros and physios, they do very comprehensive first visit assessments with the goal of identifying what is actually happening with the patient and coming out with a treatment plan to get that outcome. Now, often someone can come in and see one of the chiropractors who then identify that they think some of the elements of the care of that client will be better served by seeing physiotherapist or integrating massage or integrating exercise physiology. What have been your experiences of working backwards and forwards with clients where they swap backwards and forwards between the different elements of the team?
Yeah, holistic health is a term that essentially was supposed to achieve that in clients, and it was a bit of a hot phase word, you know, the last sort of 10 years. And you don't hear it as much now, but you definitely hear that, you know, we're allied health professionals working collaboratively. But sadly, a lot of the time you go to a clinic and they pitch themselves as being collaborative, but they're not really at all. And that means that you might have multiple allied health professionals who are working in the same building, but they're certainly not working together. Really lucky here at the Institute of Sports and Spines that it is core for us to ensure that we're getting the best outcome for the patient, which means that we talk as professionals with your permission about your treatment and your plan. And we also keep comprehensive notes, which means that if one of us are away or you have a reaction to some other treatment, we can follow back down on the notes and work out maybe what would be better suited in the future to again make sure that we're working towards the best outcome for you.
With the evolution of evidence-based medicine, I've seen an enormous change in the healthcare landscape in my career. With physiotherapy in your career, what have you noticed as changes in treatment approaches where what we were talking before about some people viewing that seeing a physiotherapist was pointless, they didn't get any results for them. Some of those people might have been machine-based where they put a TENS machine on someone for 10 minutes, an ice packet for 10 minutes and then sent them home. That's not really the approach now, is it? So can you tell us a little bit about your experiences with that changing profession?
Yeah, that's right. There was a time certainly where ice packs, heat packs and TENS machines were a commonplace in treatment for physiotherapy. And the APA has worked very hard in trying to rule out what's called low-value healthcare, which means what the patient benefits, how much do they benefit from the treatment that you're providing. And the research showed that things like TENS machines and just a hot pack for a session and calling that a physiotherapy session wouldn't actually result in a large enough outcome that was significant. So we have definitely, as an organisation, moved more to active treatments versus passive treatments. So passive being that things are being done to you while you lay down, and active being that you're taking a more participation role in it, whether it's movement through stretches, and also that approach is then streamlined onto exercise is medicine. So that's a logo that's been used both by ESA and the general health landscape, and physiotherapy is no different in adopting more exercise prescription in the actual prescription of treatments.